this show, we're going to discuss some public health issues. What is public health? Public health is the science of protecting and improving the health of families and communities through promotion and healthy research and injury prevention, as well as the detection of various infectious disease. So guys, public health was viral before it was cool. Guys, we'll be back after this short break. Welcome back to Good Morning Oshawa. On today's episode, we are going to talk about the growing concern, the flu, also known as influenza. It is a major health problem affecting hundreds of people. With me today, we are lucky to have Dr. Benson to discuss with us about the influenza virus. Welcome, Dr. Benson.
Thanks for having me.
So doctor, what is influenza?
The influenza flu is a common respiratory illness that runs usually from November to February. And so the flu is transmitted from a person to person with direct contact. And it also affects millions of people each year in Canada.
That's really interesting. So what are the common signs and symptoms of the influenza virus?
The infections of the nose, the throat, and the lungs can cause influenza or flu-like symptoms.
And now we'll take some questions from our viewer audience at home.
Well, my question to Dr. Benson was, how do I prevent my kids from getting influenza?
There are 5 levels of prevention.
Primordial prevention consists of actions to minimize future hazards to health and hence inhibits the establishment factors known to increase the risk of disease.
Examples for primordial prevention is sneezing or coughing to the bend of your elbows. And also, washing your hands is one of the most effective ways. The second level of prevention is called the primary prevention.
Primary prevention seeks to prevent the onset of specific diseases through risk reduction by altering behaviors or exposures that could lead to the disease, or by enhancing resistances to the effects of exposure to a disease agent.
The most predominant example of primary prevention that people take annually is getting your vaccine shots.
I hate needles.
It's okay, we have lollipop for everyone. The third level of prevention is called the secondary prevention.
Secondary prevention includes procedures that detect and treat preclinical pathological changes and thereby control disease progression.
The most effective secondary prevention is going for annual checkups during flu season. So go see your local doctor. The fourth level of prevention is called the tertiary prevention.
Once a disease has developed and has been treated in its acute clinical phase, tertiary prevention seeks to soften the impact caused by the disease on the patient's functioning, longevity, and the quality of life.
So in a hospital setting, we use PPEs, which includes gloves and masks. And also, if a person is sick with the influenza virus, they should stay at home. And while at home, they could eat well and exercise to get better. The last level of prevention is called the quaternary prevention.
Quaternary preventions are actions taken to identify patients at risk of over-medicalizations, to protect them from new medical invasions, and to suggest to them interventions which are ethically acceptable.
So for this last prevention, education is the key. So if you have any questions, go see your doctor.
I'm OG, y'all new to the game.